So I would ask though, for someone that is, does have Parkinson's disease, it sounds like having a personal trainer may be a good idea because you're getting all of these things that you're mentioning. You're getting that feedback. You're getting someone to help challenge you more. It's that challenge. You don't want to. You don't want to just be in your comfort zone like you would if you were walking your dog.
Right.
You want to push yourself more. Right. And so it helps to have someone.
It does.
Or a group class.
It does.
With feedback and.
Right.
I mean, it's.
Yeah, I think it's great. You've touched on a number of different things. I think first of all, number one, I think in general we like having patients with Parkinson's have exposure to physical therapy one-on-one periodically, and I think the idea there is what you've said. For a couple reasons. Obviously, one, you want to make sure you're challenging yourself. You want to make sure you're not hurting yourself. But also, you really are gaining kind of a tool set and feedback on what you need to be working on. And it is, as I said, getting the feedback to be accurate and problem solve to do it again better, right? And so, you definitely want to progress and get better, number one. And two, you can kind of use those tool sets to, apply now to a class. Which is, so you're doing, what your class, but you kind of know what you need to be working on. So I kind of like that combination. I think the other thing, so getting that one-on-one I think is always great. And I think for Parkinson's that's particularly true because they have some deficits that they really should be working on and focusing on. Getting that feedback is important. They may not recognize it, so that feedback is important. The other thing I was going to say is I like people also to kind of mix things up a little bit, do a lot of different things. So, once you try one thing, maybe mix it up and do something a little different. I think that's also important. Doing something you love, the whole idea of self-belief, is self-efficacy, self-belief, the idea that you're going to do better if you believe you can gain benefits from it, and if you enjoy what you're doing are really key. And so I think that's also why the idea of obviously getting some feedback with physical therapy, but then doing something you love, you enjoy, you want to learn is good. Mixing it up both from the skill set, do different things, and mixing it up from the different environments. I always say, look, we live in Southern California. We've got, I don't know how many different types of terrains here. It's not that hard to mix this up. So it's really going back to the idea of mental flexibility, exploration, and fundamentally play.
Yeah.
It's play, which is all those things, really.
Definitely increases compliance that you'll keep doing it if it's something you enjoy doing and like doing.